So we delivered Connlie in Medical City Arlington, and she was perfectly healthy. And we had 5 great hours with her before the postnatal nurse came in and checked her vitals and noticed a little blue spot on her back. So they took her up to the NICU immediately and flew her to Medical City Children's Hospital in Dallas.
I think the hardest part of that day was leaving Medical City Arlington, without a baby, because next thing we know, she's getting flown off in a helicopter, and we had to leave the hospital without a baby to drive over to Dallas.
Shortly after birth, Connlie had a diagnosis of tetralogy of Fallot that was made while she was in the neonatal intensive care unit in Arlington. And she was immediately transferred here to Medical City Children's Hospital, where I first met her in the cardiac intensive care unit. She was born with a hole in her heart. There was actually no connection from the heart to the lungs. There was just a small blood vessel called the ductus arteriosus, which is part of fetal circulation, and that was what was keeping blood flow to her lungs.
Receiving this diagnosis postnatally was rough just because we have 2 other children at home and we had to make life normal for them. We're also caring for our baby girl, and that's really where Medical City Children's Hospital stepped in. The nurses became our family, the doctors became our family, and we knew that when we weren't here, she was being well loved and taken care of.
Really, you want to make sure you have a good care team, and to have a team that's successful, you have to have people that are specialized within their areas. For me, my specialty is perioperative imaging, and so that means getting details on the echo that really make an impact on the surgical approach or the medical management approach. And so really with her, it was looking at her heart, how well developed her lung vessels were, and trying to figure out what was the best time to do surgery so that her body had adequate time to adjust to being outside of the womb.
They walked us through each step on our way home. We knew we had a plan, and I guess we knew that we were constantly being watched over, and they actually developed a personalized plan for each baby.
We chose to operate on her, and she underwent a complete repair to create a normal pathway for blood to go from the heart to the lungs.
We were very blessed that we had a successful surgery, and Connlie is doing well. She can play soccer, she can dance, she can do whatever.
She just may see the doctor more often than other babies for checkups, but
right. No matter where life takes us, and our little family will continue to come in Dallas and have Dr. Thankable and Dr. Golisarian take care of our little girl.